If you're evaluating EHR and practice management software in 2026, you're likely looking to solve one of two problems. Either your current systems feel fragmented, charting in one place, billing in another, and reporting somewhere else, or you're starting a practice and you need a full solution so you can focus on providing exceptional care. That's where AdvancedMD comes in. In this video, we're reviewing AdvancedMD in detail, what it is and who it's best suited for in 2026. This episode is sponsored by AdvancedMD, but as always, we're keeping the breakdown fair, data-backed, and buyer first. Let's dive in. What is AdvancedMD? AdvancedMD is a unified platform that combines EHR, practice management, medical billing, patient engagement, reporting and analytics, payments, and more. It's designed for independent medical practices and specialty groups across a wide range of outpatient care settings. Core specialties include family practice, mental health, internal medicine, physical medicine, for example, physical therapy, chiropractic and rehab specialties, surgical specialties, pain management, OBGYN, orthopedics, radiology and imaging, pediatrics, and more. It supports both small practices from 1 to 3 providers, as well as large multi-provider organizations with dedicated enterprise support for bigger groups. In short, it's built to connect clinical workflows and financial performance in one system for virtually any size of organization. AdvancedMD, strengths and differentiators. Number 1, unified clinical and financial workflows. Many platforms handle charting well, but require separate billing systems. Others are strong in revenue cycle, but feel rigid clinically. A major strength of AdvancedMD is its unified and holistic platform. Documentation, scheduling, billing, claims, and reporting all live in the same ecosystem. That reduces duplicate data entry and keeps financial data directly connected to encounters and coding. Number 2, customizable specialty workflows. AdvancedMD supports multiple specialties with configurable templates rather than forcing a one-size-fits-all structure. Providers can personalize templates to match how they document. In family medicine and internal medicine, that flexibility matters for chronic care workflows. In surgical and specialty environments, it supports more tailored documentation patterns. The result? Charting that adapts to your providers and specific workflow needs, not the other way around. Number 3, strong billing and revenue cycle capabilities. In our SelectHub research, AdvancedMD scored in the top tier for billing automation and patient payment management. Capabilities include automated claim scrubbing before submission, insurance eligibility verification, structured coding tools, AR control center visibility, integrated credit card and digital wallet payments, automated payment reminders, and more. In case materials, Oklahoma Otolaryngology Associates reported reducing accounts receivable days from 45 to 50 down into the 30s after implementing AdvancedMD. The Center for Balanced Health reported billing tasks dropping from hours per day to minutes. Number 4, patient engagement that supports growth. AdvancedMD earned top marks in our Analyst research for patient engagement. The platform includes patient portal access, secure messaging, online bill pay, digital intake and check-in, automated appointment reminders, and more. Because engagement tools are built into the same system as scheduling and billing, there's less friction across departments. Number 5, reporting and operational visibility. AdvancedMD includes over 150 pre-built reports, along with financial dashboards that track revenue trends, claim approvals, outstanding balances, and provider-level performance. Administrators can filter by provider, service category, or insurance carrier, and the dashboard includes task visualization tools to quickly surface labs, refills, and messages. Themes from AdvancedMD reviews and customer stories. In looking at real-world feedback from third-party AdvancedMD reviews and customer testimonials, here's what customers say they like. Time savings and clinical focus. Some providers explicitly tie AdvancedMD to time regain for patient care. For example, Dr. David J. Hale, a podiatry physician, explains that using AdvancedMD integrated with Dragon Medical Practice Edition allowed him to dictate findings 3 times faster than most people type, improving note quality and freeing up meaningful time with patients. This is consistent with a lot of practitioners' feedback around significant time savings. Practice transformation stories. Certified Healthcare Network, a medical billing service, turned to AdvancedMD to support growth and help multiple client practices improve financial performance, helping them scale beyond a single office and support outsourced billing environments. Meanwhile, at La Loma Medical Center, a 2-location family practice, the transition to the AdvancedMD web-based system liberated the practice from clunky, disparate legacy systems, helping streamline billing, claims, and record management while improving remote access for providers. Ease of use, integration, and customization. Independent reviewers often note workflow flexibility and configurability as a major plus. On Capterra, one long-term user says AdvancedMD is an excellent, well-integrated PM/EMR that contains the tools needed to run a solo practice efficiently, including reporting, messaging, e-prescribing, and patient portal, and calls the platform very customizable. Other reviewers noted the ability to create and edit templates without vendor intervention, which gives smaller practices control over how documents are structured and speeds up processes. Financial and operational transparency. Independent analyst reviews affirm AdvancedMD's strengths in financial workflow support. Business.com's independent review points to nearly 96% first-pass claims acceptance when using the AdvancedMD billing platform and claim scrubber in conjunction with a preferred clearinghouse, which can materially reduce denials and rework. When evaluating AdvancedMD for your group or practice, these are the kinds of outcomes worth validating in your own workflow and implementation plan. Analyst takeaway. Who is AdvancedMD best suited for? AdvancedMD remains one of the more balanced EHR and practice management platforms in 2026, especially for small to mid-sized family practices, internal medicine, ambulatory care, surgical specialties, mental health, and more. Our research also found AdvancedMD to be a solid software system for large group and enterprise practices. Core strengths include integrated clinical and financial workflows, specialty flexibility, revenue cycle automation, patient engagement, reporting depth, and more. If you'd like to schedule a demo or compare AdvancedMD against other platforms, check out the links in the description below. I'm Devin Hennig with SelectHub. Thanks for watching, and we'll see you next time.